What is neuroadaptation? What exactly is neuroadaptation? This term describes how our brain changes when exposed repeatedly to substances like drugs or alcohol. When someone first uses a substance, their brain experiences immediate effects. These effects often involve increased activity in areas related to reward, particularly the mesolimbic dopamine system. This system plays a significant role in how we feel pleasure and motivation. As a person continues to use a substance, their brain undergoes changes at both cellular and molecular levels. These changes can lead to two main outcomes: sensitization and tolerance. Sensitization means that the brain becomes more responsive to certain drug effects, which can increase cravings and the desire to seek out the substance. On the other hand, tolerance occurs when the brain requires higher doses of the substance to achieve the same effects. This can lead to increased consumption, as individuals chase the same high they initially experienced. Another important aspect of neuroadaptation is counteradaptation. This is when the brain starts to counteract the effects of the substance. When the substance is no longer present, these changes can lead to withdrawal symptoms. These symptoms are often the opposite of the initial effects of the substance and can be both physically and psychologically distressing. This discomfort can drive individuals to continue using the substance to avoid feeling unwell. Neuroadaptation also affects brain circuits beyond just the reward system. It impacts areas responsible for stress and decision-making. These changes contribute to the compulsive nature of addiction. As a result, individuals may find it challenging to control their drug use, even when faced with negative consequences. Over time, seeking out the substance can become a habitual behavior, making it even harder to stop. Understanding neuroadaptation is essential in the context of addiction. It helps explain why addiction is viewed as a chronic brain disorder. This perspective highlights why relapses can occur and why treatment often needs to address these brain changes. Behavioral therapies and sometimes medications targeting specific neurochemical systems are commonly used in treatment. In essence, neuroadaptation is the brain's way of adjusting to repeated exposure to substances. This process leads to tolerance, withdrawal, cravings, and compulsive drug use, all of which are key features of addiction.